organizers of today's event, and thank you for inviting me to address the 9th Annual Binational Policy Forum on Migration and Health. In the United States Senate, I have long supported efforts to improve the health of our New Mexico border residents. In 1993, I helped author the U.S.-Mexico Border Health Commission Act, which became law later that year. I also worked to support legislation aimed at improving infrastructure, access, and delivery of healthcare services to residents along the U.S.-Mexico border. This Congress, I am reintroducing the Border Health Security Act of 2009. This act will provide $25 million a year to fund demonstration projects along the border, including programs aimed at fighting infectious diseases, such as tuberculosis. This act also reauthorizes and provides $10 million of funding for the U.S.-Mexico Border Health Commission to continue its support of binational health projects. Additionally, the act also provides the study of binational health insurance options so as to improve coverage for people who reside on the border. Earlier this year, I also reintroduced the Community Health Workers Act of 2009. This bill will provide grants to community-based organizations for health education, promotion, prevention, and outreach to minority communities that are currently underserved and underinsured. I'm also pleased to be sponsoring the Comprehensive Tuberculosis Elimination Act. This bill will significantly increase funding for improved TB control and the research and development of new drugs as well as vaccines. Additional funds are also provided to help strengthen systems that detect, control, treat, and prevent multi-drug-resistant TB, as well as target the comorbidity relationship between TB and HIV and AIDS. Understanding the need to improve the nation's surveillance and reporting of diseases and conditions, I also co-sponsored the National Integrated Public Health Surveillance Systems and Reportable Conditions Act. This act includes provisions to improve binational disease surveillance and notifications, as well as develop guidelines for binational cooperation to more effectively manage and control infectious diseases along the U.S.-Mexico border. I also recognize the importance of preventative health care. This spring, I introduced the Comprehensive Obesity Prevention, Treatment, and Reduction Act of 2009. This act establishes a cross-agency U.S. Council on Overweight and Obesity Prevention that will provide grants for programs focused on preventing, treating, and reducing obesity in children and in adults. As you are aware, right now, Congress is working to craft historic healthcare reform legislation. The ultimate goal of this reform is to ensure that all Americans have access to meaningful and affordable healthcare coverage. As part of these efforts, I am working to improve the quality and efficiency of care while also lowering the cost of care in both private and through the public sector. Healthcare reform, as you know, is a particularly important issue in New Mexico. As many of you know, New Mexico remains the second most uninsured state in the United States. And we currently have the highest percentage of workers who are uninsured. Those with insurance know that rates of premiums continue to escalate at unsustainable levels. For example, in the year 2000, the average family of four in New Mexico paid about $6,000 a year in their insurance premiums. By 2006, this rate nearly doubled to $11,000 a year. Even more alarming is this fact that by 2016, the average family of four in New Mexico is projected to pay $28,000 a year in insurance premiums. The status quo is clearly unacceptable and unsustainable. This is why I remain so focused and committed to enacting healthcare reform legislation this year, and why I am so glad to be partnering with President Obama as we meet the urgent healthcare needs of New Mexico and our nation as a whole. Thank you for giving me this opportunity to update you on various pieces of legislation I'm working on, and I look forward to